Back in the early 1980s, those of us working in the field of tobacco control, I think, never really imagined that we would get a government that would implement evidence-based tobacco control policies. But at the turn of the century, when the new Labour government came in, all that changed, and we have since then had evidence-based policies up to a point. So I want to give you a little rundown on what happened, why it happened, and what the implications are. So going back to the early 1980s, the evidence on tobacco control was pretty strong that there were certain things that we could do to get smoking rates down. There was already quite considerable evidence on the effectiveness of treatments to help people to stop smoking, including behavioural support, as we call it, which is psychological treatments, which would involve seeing someone, a specialist, and talking to them for an hour or so once a week for a few weeks, and or group therapy, and just coming in at that time was nicotine replacement therapy, first of all in the form of nicotine gum and then nicotine patches. And we knew by that stage that these were effective and would help people to stop, and that if you provided a combination of nicotine replacement therapy and behavioural support or treatment, then we were pretty confident that it would help smokers to stop. But at that stage, there was no real interest, or appeared to be no interest, in governments helping people to stop in that way. By the time we got to the mid-1990s, we'd also got evidence that there were other things you could do. We knew, for example, that putting the price up would have a fairly substantial effect on smoking rates. We also, I think, had a reasonable suggestion that preventing tobacco companies from marketing their products, and these were obviously heavily marketed at that time, would probably reduce demand for cigarettes. And we also had some inclination by the mid-1990s that mass communication programs, mass media campaigns, could prompt smokers to try to quit and probably also reduce the uptake of smoking. We also had evidence that people were dying from inhaling other people's smoke, probably in their thousands. So these are people who are non-smokers, that have no interest in smoking, and yet they were being killed by the fact that they were being exposed to smoke from other people. And in the 1990s, we had a government, 80s and 90s, we had a government that seemed to be pretty uninterested in public health generally, and specifically in doing anything to reduce smoking rates and therefore save many thousands of lives a year. So it did come as a bit of a surprise when at the very end of the 1990s, when a new Labour government came in under Tony Blair with Health Secretary Frank Dobson, that they expressed a very definite interest in putting together a comprehensive tobacco control plan that would be evidence-based. And they brought together a number of experts, both within the Department of Health, as it was, and the Health Development Agency, which was the precursor of Public Health England, which is the precursor of the Office of Health Improvement and Disparities. So they brought together experts, they reviewed the evidence, and they came up with the first ever comprehensive tobacco control strategy. And it was evidence-based, and it included a number of pretty innovative ideas. Probably key among them was the idea that they would set up a national network of stop smoking services, as they're called, which would combine pharmacotherapy in the form of nicotine replacement therapy and behavioural support. And this was originally put into place in a small number of pilot areas with high deprivation, to see how it went. And if it went well, they, again, evidence, they were going to roll it out across the country. And that's exactly what happened. And what was also very interesting at that time, again thinking about evidence-based policy, is that they wanted to put in place a fairly rigorous evaluation program that would continue for the life of the services, ideally. And so each service, which was actually organised at local level by regional district health authorities, had to collect data on their throughput and their success rates. And this was then reported back to the Department of Health, collated, and that evidence was then analysed to see how the services were doing and whether they were delivering on the promise. And we also had in place, and had for a few years, for some years, pretty good national surveys which would examine things like quit attempt rates, how many people were trying to quit in a given year, and the success rates, whether they were actually succeeding or not, as well as things like smoking prevalence. So we actually had a lot of really good evidence to be able to evaluate whether this tobacco control plan, this strategy, comprehensive strategy, was working or not. Of course, it would take a while for the evidence to accumulate and to form any kind of robust conclusions, but the fact is that the evidence was being collected. So this was what seemed to me, at the end of the last century, an unusual state of affairs. We had a government that had decided it was going to try and implement a tobacco control strategy that would be evidence-based, and it was going to monitor that strategy to see to what extent it was delivering on its promise. So that was all very good. And what we then found over the years was a pretty convincing set of evidence for the fact that indeed this tobacco control strategy was working, because we saw that smoking prevalence, which had pretty much stopped going down by the time you got to the end of the 1990s, then started to go down again. And you saw this kind of S-shaped curve, with it having gone down fairly steadily up until the 1990s, then slowed down and then stopped. But then when they introduced this new tobacco control strategy, it went down again. And it has been going down ever since. Not always consistently. Sometimes it goes down faster than others, but it has continued to go down. And successive governments have built on that strategy and updated it. So, for example, in the original version of the strategy, they didn't have a ban on smoking in indoor public areas. That was something that came quite a bit later. And again, when it did come in, it was something that was very strongly evidence-based. As it turns out, the Labour government, when it introduced the legislation for the smoking ban, had mixed feelings about it, and the Health Secretary actually was not necessarily supportive of it. But they gave a free vote to members of Parliament, and they voted overwhelmingly for the indoor smoking ban. Also worth bearing in mind that at that time, we also had evidence from other countries, and most notably Ireland, which had first introduced an indoor smoking ban, that it would have an effect, and B, that it was doable, that people would obey it. So, and that's indeed what we found when we implemented it in this country. So that came after the comprehensive tobacco control strategy was introduced, and various other measures have been introduced since then. Again, I think pretty strongly evidence-based measures to continue to bear down on tobacco. So that all seems rather good. And you think, well, okay, this is really a good news story in terms of the application of evidence-based policies in public health. Unfortunately, it hasn't all been plain sailing. For example, when it came to the guidance that was given to the stop smoking services to deliver optimal stop smoking support, that guidance was quite weak and thin, and actually stressed innovation rather than following a sort of prescribed plan based on the evidence. So they could have done a lot better then. And in fact, since then, and most recently, the stop smoking services have been starved of money, and they've gone away from a strongly evidence-based approach based on specialist behavioural support with optimal pharmacotherapy to something much, much more diluted. So an important lesson there is that you can start with an evidence-based policy, and there's no guarantees that it will be maintained, because if the political will isn't there to do it, then it doesn't matter how evidence-based it is. We've also seen that more generally with mass media campaigns for smoking, where there is very good evidence that they actually save lives very, very cheaply, and in fact are cost beneficial, which means they actually save more money than they cost. And again, we've seen, I think, largely as a result of political ideology, that these campaigns have been pretty much all but eliminated. Very, very little interest in them now. So the very, very last part of this story that I want to tell you about is something which happened this week, which is the launch of a new independent review on tobacco control strategy, which was led by Javid Khan. And if you Google it, you can find it. And it comes up with 15 evidence-based recommendations for how we should go forward in terms of tobacco control strategy. And I would have to say, given the current government and everything we know about it, I would be pretty gobsmacked if they did anything remotely like what's being suggested, but you never know. So, it's not that the evidence isn't there. It's not that you can't implement evidence-based strategies, and it hasn't been done, but you can see that it is often an uphill struggle.